this is Dr. Kate Eckert, and today I'm going to discuss how using a shockwave preventatively can be beneficial and what I personally use it for. So, I just turned 42 and I have a very physical job. So, I want to be able to have as much longevity in my job as possible. I use my hands a lot. I'm on my feet a lot. I'm bending over patients all day. I do a lot of intense muscle work for people, and that does take a toll. So, some things that I am currently set up to have worked on more as preventative. So, they do give me issues sometimes, but I'm going to be using them to prevent a problem later are first are my hands. So I use my hands every day for active release technique and different myofascial release things. So lots of pressure on my thumbs and fingers. And sometimes when I am really inflamed, I will notice that it does cause pain. Or if I'm eating a non anti inflammatory diet, I will have more discomfort in my hands in the morning right when I'm getting started. So I want to prevent any serious degeneration in my hands to give me that long lasting care for my hands. So what I use is Shockwave on my hands to do the entire thing, and then I focus in on the joints around my thumbs since I use them the most. I use a little bit of a deeper treatment to work on the cartilage in my thumbs and help it regenerate. It's pretty interesting how we can do that in all the joints as long as we can get deep enough. I increase the circulation in that little piece of the bone close to the cartilage, and it helps stimulate the growth. So, really helping preserve my thumb joints for the long haul. And that's really important to me. So, when I'm using my hands, I'm also engaging the muscles in my forearms, and that also can give you things like carpal tunnel or tendonitis in the elbow, that kind of thing. So, I usually also will check those to make sure that I don't get a problem like that, because carpal tunnel could really affect how I treat my patients and make it hard for me to do the work that I need to do each day. So that's the first thing that I focus in on. The other thing is my hip. My left hip, I had a pretty bad injury with probably 4 years ago. Now, that was before we had Shockwave. So I was able to rehab that with exercises and some soft tissue work and that kind of thing prior to getting the shockwave. Now, the lead up to that is that I had a long history of dancing all the way from when I was a toddler through college. I did a lot of yoga. I have a very, very flexible joints, and it led well with cheerleading and dance and gymnastics, all those things that I did a lot of. It really overstretched the ligaments and tendons in my hip and made it a prime candidate for labral tears and some degeneration. So, what I'm doing now to help regenerate those tissues that I overtaxed and overworked in decades of use. I will be starting to shockwave some of those deep rotators, hip flexors to help regenerate the tissue that I really put to the test through all that dance, cheerleading, gymnastics, and yoga. So we'll be working on that starting here soon. And then I have a little bit of foot pain. So I would definitely not classify it as plantar fasciitis or anything like that, but I'm just starting to get a little bit of pain in my right foot when I wake up. So I talk to my patients a lot about the deep frontal line. We do have an episode on that. I am a stress clencher of my jaw, and when you have that, you can tend to have jaw issues, some diaphragm issues, some deep hip flexor issues that would affect my hip. but then also it ties in fascially to your feet. So a lot of times we see people with TMJ, pelvic floor issue, whether it doesn't necessarily show up as like incontinence or anything like that, but it could show up as hip pain or back pain, and then your foot. So this isn't unheard of for me, even though I've never really had foot pain before. I know that it's something that's tied to the other issues that I have. So as soon as I feel a little twinge of something going on in the morning, it is way, way easier to treat that immediately and get it to resolve quickly, than waiting till you're needing to wear OFOs, slipper, sandals in the morning because you can't put your feet on the ground. So we wanna catch it as soon as we feel it rather than letting it snowball into something more serious. So it'll probably take me just 1 treatment, 2 treatments to totally make that go away, rather than my patients usually don't come to me with, like, plantar fasciitis until they've been suffering with it for months, years, on and off, that kind of thing. And that it does make it, make you have to take 6 or more, 6 to 12 treatments to resolve. So I think that's why my staff and I and my family respond quickly. My parents live across the street. Any little thing that they feel, they'll come over and we treat it right away. It fixes it really quickly because they don't wait on it. So we'll do my foot, and then I do where I get stressed, I clench my teeth, and that really leads to some clicking in the jaw, TMJ like symptoms, and then headaches. So I haven't been doing that for quite a while since we got the machine, and lots of stress with work and keeping your kids all in their activities and on their things on time. So be working on the headache protocol and TMJ protocol again for me. One thing with that we would love to integrate for our patients is that if we could find a way for people to address the stress aspect of their pain as well as the structural. So we try to encourage people to do our diaphragmatic breathing and that kind of thing to help stimulate their vagus nerve and help with their stress response. So I do try to do that. I've also taken a Vedic meditation course and I'm trying to reintegrate that. It's easy to get out of the habit. With that type of meditation, we do it twice a day for 22 minutes, which seems like it should be short and easy to do, but sometimes, like, it's really busy and it's hard to commit to that, but that is the goal for that kind of meditation, and it really helps with your stress level, and we have another podcast episode on that. I have a great resource for people to reach out to if they're interested in that, because that really helps with the TMJ and headache issue. It helps with pelvic floor issues. Those are 2 areas that we end up clenching when we're stressed. So if you are like me and you might have maybe some trouble managing your stress, that's a great option. What I mentioned earlier with my hands, with the when I eat a lot of sugar or something inflammatory, it really makes me feel those weak spots in my body, like my hands. We have another great resource in our office to help with anti-inflammatory diet. Bethany Contaxis will see patients in our office, and she has her master's in nutrition. So she's not a dietitian, but she has her master's in nutrition. She had to have 1,000 hours of working under someone who is a licensed nutritionist, licensed with the state. So it's different than somebody just calling themselves a nutritionist that's had a weekend course. She has had her master's degree in it, and she's had 1,000 hours of working under someone to be, certified and have her license with the state. She's a great resource. She does a lot with nutrition in general, but also with women's health as well. So that's another option to do at the same time. It's great tailored in together. For some other things that I'm working on, I'm trying to commit to using our vibration plate in the office. If you've been in the office, you most likely have used our vibration plate in the last year. We're really encouraging patients to use that after their appointments. It's totally free for our patients, and it is great for stimulating your lymph system, and that helps with your inflammatory levels as well. So if your lymph system is moving well, your inflammation comes down, and that helps with our healing. It helps with our treatments work better. It helps with your post shockwave soreness. And then at a certain level, if you get up high enough, the vibration plate helps with bone density. Now, I've never had a DEXA scan. I just turned 42, but I had half of my thyroid removed. I am on thyroid medication that can have a side effect of weakening your bones. So that is something I'm concerned with, and that's something that I'm gonna try to do every day to help with bone density. So if any of those issues are something you have going on, that is a benefit of coming into the office that you can utilize and that we think is really great for our patients. Now with laser, I will be lasering my sides of my head to help with that clenching. And then if I have any kind of issue with little sprains or that kind of thing, and then at the end of my hip treatments, I will be using the laser on that area as well. We recently learned in a seminar that we want to really use the shockwave first and then integrate the laser in about 4 treatments and afterwards. Oh, and I will also be testing out the shockwave. I use it on my jaw for TMJ and headaches and around the ear, all the way around, but I will also be using it on my face as well for some anti-aging benefits. So Shockwave creates cell regeneration, and that is super important in skin health and look and that kind of thing. And it also increases collagen production. So I'm going to be testing it out and using it on my face to improve the appearance and anti-aging features of it. Some good studies out there that I've been reading on using it to promote or collagen production and cell regeneration. And of course, we always do things super safely. Our machine is great in that we can know exactly how deep we're going into the tissue. So obviously for my hip, we're going to be going in up to the deepest level, and that's 4 centimeters in. My face, we will be doing super superficially, only staying with that thickest pad that will give us the most superficial depth. So you have to know where your structures you're working on and know what the goal is to give you the best treatment. So is my birthday segment on what at 42 I'm doing to give myself some anti-aging and some preventative treatments that will help me keep working without pain, but also stay active with my kids. So I don't really have any activities that are like, oh man, I wish I could do that. I'll still ski with them. I still ride bikes with them. I still do splits on my daughter's balance beam with them. There's not really any activity yet, knock on wood, that I feel like I can't do with my kids. And I want that to be the same thing I'm saying when I have grandkids, just like my dad. So my dad is 70. He still skis with my kids, gives them shoulder rides from the ski lodge to the parking lot. There's things that I want to be able to do even when I'm 70, and this is a good starting place because if you don't start now, it's going to be much, much harder to do when you're 60s and 70s. So I hope everyone's having a great day, and let me know if you have any questions about these treatments.